Well, good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Monday, October 24th, 2022. And our top story today, tips to save money on your next dental visit. Well, Catherine, it's great to see you. Thanks so much for joining us on the program this morning.
Thanks for having me.
Well, we're going to talk about dentistry today, and neither of us is a dentistry, but we're going to talk a little bit more about the costs associated to dentists. And Catherine, let's just start off. More and more Americans, during the pandemic, I think a lot of people put off taking care of their vehicles, but also maybe taking care of their teeth. More and more Americans are headed back to their dentist.
That's right. Hopefully, if you've been putting off your dental checkup, you're getting it. One thing I think people can maybe relax a little bit about is, you hear the every 6 month dental visit. That's not necessarily a hard and fast rule. It's a good rule of thumb, but there's evidence to suggest that, some people may need less often, some people may need more often. So, it's not a hard and fast rule.
Yeah, absolutely. And let's, one of the things that makes my skin crawl when I go to the dentist is one, sitting in the chair like this and being very petrified, even though I know they have my best interests at heart. But also when I walk away, I have to pay the bill. And there are some tips that I know you and the folks at CR, Consumer Reports, have uncovered to really make the dentist appointment more cost efficient, I should say.
Yeah, of course, if you have access to dental insurance through your employer, it's a good idea to go ahead and take advantage of that. Less clear of an advantage is sort of buying private dental insurance. That's really expensive. It's not clear that it's going to save you a lot of money, but there are some other options. There's a thing called Dental Savings Club, which is a little bit like a membership program. You enroll for a nominal annual fee, and then you have access to bunch of different dental discounts depending on what provider you're seeing. So Dental Savings Club is a really good option. And then there's a few other things you can do, if you aren't in a hurry necessarily to get care, it's a good idea to check out local dental schools and dental hygiene schools. Those students are learning about how to clean teeth and take care of teeth, but they are supervised by professional dentists and professional hygienists. So it can take longer because they're learning. It can take time to get in for an appointment, but that's another good way to get dental care kind of at a lower cost.
Yeah, it's not like you're getting open heart surgery just by walking in the clinic, right? They're there to learn how to clean teeth, and you could be a patient in that regard. And you probably walk out of there with a really cheaper version of dental cleaning. Catherine, let me ask you about one of the things that I always get asked when I go to at least one time a year is to get X-rays, and they have. So back when I used to get, don't tell anybody, but back when I first started going to the dentist, they actually use X-rays and film. Now it's all digital. So the X-rays don't have to be developed anymore. But that can be a very costly component to getting your teeth clean.
That's right. So I don't know very much about the cost of X-rays specifically, I have to say. That's something that I haven't looked into. Your insurance, if you have, again, employer-sponsored insurance, it's likely that dental X-rays are covered. I don't know that there's a need to sort of get more dental X-rays beyond that unless you have a specific issue. So, if you get told you have a root canal, you need a root canal or something, they should definitely be doing an X-ray to make sure. That's one of the things that you would want to see them do to make sure that you're they're telling you you need a treatment that you actually need. So, x-rays definitely have a role, but I can't speak more to necessarily the cost.
Yeah, but right, you're right. They have a role. It's important. They can also see like erosion and things like that on the teeth that you couldn't see just by scraping and I forget what they call it, but doing all those the techniques that they know how to use. Catherine, I need to take a very quick break. When we come back, we'll talk more about tips for saving money on your next dental visit. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Are you over 50? Would you like to get up to 33% more income in retirement? Then call now for this free book, Annuity Do's and Don'ts for Baby Boomers. This free book reveals little-known secrets about annuity strategies that will help you make the right choices before buying an annuity. Call right now for your free book, and as a bonus, we'll also throw in a free annuity rate report, both absolutely free for calling Annuity General today.
Call 800-504-8194.
Well, Catherine, thanks so much for sticking around with us this morning for segment 2.
You bet.
And actually, look, I have to confess, I think our segments are a lot less painful sometimes than going to the dentist. But be that as it may, I was looking at somebody, I'm joking, I love dentists. We actually do have dentists on the program from time to time, and they serve a very important role. But, in looking at some of the research that you had done, very few people get a second opinion when it comes to things like getting a root canal or getting a cavity filled or some other process like buying auto insurance or going to some other doctor. It is important to possibly look at other alternatives.
Yeah, I mean, I wouldn't say you need to get a second opinion every time you're told you need a procedure, but it is always an option that I think people need to understand that they can exercise. If a dentist, if you have a trusted dentist and they've told you, you need a procedure, and they've done a bunch of tests, they've explained to you why they're doing the tests, why they think you need a procedure, what symptoms are you're having that would lead to this. An important part of informed consent is a dentist explaining to you all of your options. So they may recommend a procedure, but they should also say, like, here's what will happen if you do this alternative treatment plan, or here's what will happen if you do nothing. And they should also take into account your preferences. So some people may prefer to, head off a problem before it gets more serious. Some people may prefer to take a wait and see approach. Like, a dentist should be taking your preferences about that kind of stuff into account. If you feel like that kind of stuff isn't happening, you don't feel like your preferences, you're being heard, you don't feel like the dentist is properly explaining what's going on. Those are some good signs that you may want to, get a second opinion. I mean, it's always good to, if the price tag they quote you is really high, if the treatment plan they're telling you seems really unusual for you, you've never had a cavity and suddenly they're telling you you need 10 fillings. That's something that I've heard from dentists a lot, that they'll get people in for second opinions. They had a dentist tell them they needed a bunch of fillings and they had never needed them before. So those kinds of things, always know and be willing to sort of exercise that option to get a second opinion if you feel like something isn't just right.
Yeah, and I know in some of your reporting you talked about getting fillings, and age is not a reason to get a filling, right? I mean, just because I'm a little bit older doesn't mean that I need to get a filling. Now, if I have decay, or and I've had this with my own teeth. Again, this is my show, but it's also TMI. If you have some kind of decay in your actual old filling, they may need to replace that. But you don't need to get a filling just because you're older.
Well, and you don't need to get a filling just because the filling is older. A lot of times you may hear oh, you got this filling a really long time ago, we need to replace it. But if the filling doesn't have any problems, if the filling is still doing its job, it's just that it's old, that's something that you can push back on. You don't necessarily need to replace those just because they're old if they're still working. But they can develop decay. Their stuff can get in there. Sometimes they do need to be replaced. They can break, those kinds of things. But just because of their age, that shouldn't be the only reason why someone's recommending replacing your fillings.
Last question, Catherine. We see a lot of ads, and we actually hear from our dentists about getting kind of these newer sonic-based toothbrushes, and I think they probably have a lot of merit. But can you still get by with the old-fashioned toothbrush that just has the bristles and some dental floss and maybe some good old mouthwash? I mean, those are tried and true, and I think served many people for many, many decades before we were able to invent the sonic toothbrush.
Yeah, I mean, you definitely don't have to use an electric toothbrush. I do think there is some evidence to suggest that the electronic toothbrush does have a little bit of an edge over the manual toothbrush as far as getting your teeth clean, but it doesn't mean you can't do a good job with the plain old toothbrush. But I would emphasize that you also definitely, whatever toothbrush you're using, you do need to floss. That's a step I wouldn't skip. The toothbrush can't reach all of the surfaces of your teeth, and the floss is important for getting in there and scraping away that bacteria that builds up. And that can be string floss. If you don't want to use string floss or can't use string floss, you can use a water flosser. There's other, between teeth cleaning tools that you can use, but something to get in between the teeth.
And I would wager to bet, by the way, that there's probably, Consumer Reports has been around for decades. There's probably an article out there on Consumer Reports that talks about the different types of toothbrushes and the flossers and the different devices, right? I have to think that at some point you and your peers have probably compared them and looked at the pros and cons of each.
Well, we definitely have electric toothbrush ratings up right now. So you can go, those are, up to date. Comparing the electric toothbrush. Some of them are really expensive, so that could be very helpful for people in trying to find sort of a good one that may not quite break the bank.
There you go. Well, Catherine, it's so great to see you. Thanks so much for joining us, and we look forward to having you back on the program again very soon.
Thanks for having me.
That wraps up this episode of BRN AM. Have a topic of interest, someone you think we should talk to, drop us a line. And don't forget, for all the latest curated news in lifestyle, wellness, finance, tech, entertainment, so much more, and all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archive, check out our latest content? Well, of course, you can visit our website and all of our streaming partners. We're back again tomorrow for another edition of BRN AM. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.
But if you're tired of the same
Now is your opportunity to co-create content around any topic on the First Lifestyle and Wellness Network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.